Unfortunately, progress in how we treat breast cancer will continue. Joining us live now this morning is breast surgeon Dr. David Weintritt. He's here to talk about a brand new innovative approach to treating breast cancer. It's a very little device called the BioZorb. Good morning, Dr. Weintritt.
Good morning, Caitlin.
All right, so you're going to talk to us a little bit about this little device and how it's helping women with breast cancer. So why don't you start by explaining the BioZorb?
Sure. Well, for starters, when women are diagnosed with breast cancer, many of them are early stage. And if you're early stage breast cancer, you qualify for treatment using a lumpectomy, breast conservation. In order for that to be successful, it's combined with radiation. The BioZorb device functions in three ways. First, and most importantly, it helps target the area where the radiation needs to be delivered. So when I do a lumpectomy, after the cancer is removed, the BioZorb device is implanted at that site. The radiation team then can target it, knowing exactly where the treatment should be given. It makes it more accurate, makes it more effective, and it can also sometimes reduce the amount of radiation someone has to get.
Okay.
Secondly, it functions as a long-lasting target of where the cancer was. We always have to be surveilling these women with mammograms to look for evidence of recurrence. This way we know exactly where to look. And then third, and this is very interesting, from a cosmetic standpoint, obviously my goal as a breast surgeon is to remove the cancer, but then to reconstruct or recreate a breast that the patient's happy with. This can help function as scaffolding to help reconstruct a better, healthier breast.
Okay, perfect. And then obviously this is something that a lot of women might not know about at this point. So why don't you really quickly tell us, I'm sure a lot of people would be thinking, is this safe?
Yes. So the device is FDA approved. You know, and it's made of two materials that we use in surgery all the time. It's a three-dimensional coil comprised of an absorbable suture material. And then there are 6 small titanium markers embedded along the coil pattern. What happens over time is the absorbable part obviously goes away, and the markers will remain, both, again, for the targeting of the radiation and for the monitoring afterwards. And studies have shown no complications in regards to issues related to the surgery that are specific to the device in any way.
Okay. And then just really quickly, I know the American Cancer Society just came out with new guidelines regarding mammograms. What do you tell your patients? Do you agree with the recommendations?
The recommendations to me are confusing. If you go on their website, they comment that mammograms have shown breast cancers earlier and have helped save women's lives from breast cancer. They also say that while they are now suggesting 45 to begin, if you want to start at 40, it's okay. They say 2 years after 55, but if you want to do it every year, it's okay. Not so much a guideline. It's an important part of an annual visit that I get to share with my patients. We get to look for breast density, we get to talk about their current issues. So mammograms, in my practice and others, should still be done once a year.
All right, perfect. All right, we're going to have all this information, especially specifics on the BioZorb, up on our website. We're going to have all of Dr. Weintritt's information up as well. So if you have questions, you can reach out to his office. And that'll all be up on our website, yourforestate.com. Dr. Weintritt, thank you so much for stopping by this morning.
My pleasure. Thank you.
All right, we'll be right back.